in the community as people are gradually getting better. That would give us some idea. Well, have people reached a plateau in their improvement of a function we're interested in? Or are they still improving, and so we should keep pushing that therapy? Or if they've hit a plateau and then start to decline, what's going on there? Well, now we can detect that from day to day, not at the end of 1 month or 3 months or 6 months. And so institute some feedback and alter the intervention so that it has benefit. Another thing we get to do is think about dose response curves. So any medication you take has gone through FDA in its licensing to look at, well, what dose gives you your best response without causing adverse effects. But if we get into biological interventions for neural repair or into physical or cognitive therapies in rehabilitation for these neurological diseases, we don't really have any way to do a dose response curve. We pick an arbitrary number of treatments in our clinical trials and we give them. And then we hope that we've given enough based on our prior experiments to get an effect. But here, we can redesign the way we do trials and take people who are still improving and continue them, and people who've hit a plateau and say, well, that's the max for this particular kind of intervention. And maybe we need to add a second intervention. So dose response curves are going to be really important. When we do trials, we lose data. People drop out. They can't come back for a follow-up visit. And that's like losing gold down the sewer, because every patient is so valuable. And by having continuous measures, we can have measures throughout the day and week and months of that trial and be able to then impute where they might have gone along that curve of recovery that they were in. And